Hi, I'm Dr. Greg Doerr, and I got with me Dr. Jake Lavere, and what we're going to be doing is talking about how conservative management healthcare providers like ourselves actually integrate in some of our manual therapies, rehab therapies, and topicals in order to help create a safer pain environment for our patients, especially considering the massive opioid problem that we have in the United States right now. Chiropractors in particular are basically set up to be a great intervention to assist in creating a safer pain environment for our patients. So Jake, four of the major things that we look at associated with modalities that we use in helping to control pain and to stabilize patients, get them into an independent role, are things like rehab, soft tissue techniques, our taping techniques, and using topicals. So how is it that you integrate some of that into your practice, and in particular, take one at a time, starting maybe with some rehab things, and how is it that you incorporate it into your practice? How do you get your patients to utilize rehab to create a safer pain environment for your patients?
Sure. I do a lot of sporting events throughout the year, so I'm more of a field doc. And so when you're dealing with that, you have to figure out how to look at an athlete, diagnose, and get them back on the field as quick as possible. And a lot of the times you're not able to prescribe, especially as chiropractors, you can't, to be able to get them back on the field. So you have to get creative. And so taping, doing CLX, biofreeze, they all come into play because they're different tools that you have in your bag to be able to get them back on the field as healthy as possible to make sure they don't re-injure themselves, but also at the same time get them performing at their top level. And so I use those techniques in my clinic with the everyday population to be able to get them out of pain, get them out of whatever structural issue that's going on, and get them back to a functional issue to where they don't re-injure themselves. They don't have to come into my clinic time and time again and for the same issue. They don't say, "Doc, that felt great," and then 3 weeks later they come back. I use this to be able to find what's going on, the underlying condition, and continuously correct whatever's happening.
So basically you're also going by the same modality, which is, you look at the point of pain, you're probably missing the problem. Now, I have to ask you a question specific to you, especially your sideline work, because I've spent a lot of time in my career, at least with Sidelines as well.
Sure.
The biggest challenge you have is, if you're going to get somebody back on that field, obviously diagnosis first and foremost, you have to know they're stable to get back out there. But it's a lot more challenging to integrate in some of those modalities that we have the time to do in our practice to see changes that are happening. But you've got split-second decisions that you have to make, or interventions that are going to make a massive change really quick. Mm-hmm. From that perspective on the sidelines, what are the big ones that you go to almost immediately to make that big whopping change that can get a person back out on that field quicker?
I tell you what, it's my hands are the foremost and utmost best tool that I have. Secondly, being able to find out what positions, what different movements that cause an issue, and then figuring out how to correct that as quick as possible. And a lot of times, if you don't put any force, so the CLX I use a lot to be able to figure out, okay, maybe they can move, but they're going to be back in the dynamic, very structural and very impact sport very quickly. I have to put some resistance to be able to make sure that they're able to handle it. If I can't do that, then there's no way that I could, as a doctor, put them back in that environment, because they are going to re-injure themselves. So the CLX is one of those tools that I use. If I find that and I could tape them up and then do the same resistance again, and I realize that they have no pain whatsoever, then I know that they're able to handle whatever position they're going to be in that sport that they're creating.
So you're even using some of that rehab as diagnostic, not only from a standpoint of, hey, I'm going to use this to help train you, correct motor pathways, and stabilize soft tissue, but you're also using it to see if they're capable of actually going back to their sport-specific activity.
Oh, 100%. If just having them stand and do a couple of march in place and this and that isn't going to be ortho test or fantastic, but if I don't put some resistance, or at least put them in that somewhat positional movement pattern that they're going to be in their sport, then what good did I do? Right? I'm putting them in harm's way, and I have 2 minutes to do it. Okay. Now you take that into a regular clinic position, you do the same thing. You're able to get people better quicker, because they're going to go out of your clinic and life's going to beat them up. All right. And if you don't have a way to be able to look at that and say, what else can I do? What's a better way, while I have them here, to put them out in the life's position and they're able to function in a corrective and non-painful way? That's where I use the CLX, I use the BioFreeze, and I use the taping as an addition to myself once they leave.
Now, that's actually really interesting, and this was a great perspective from somebody who actually is working the sidelines, and how it is that they can integrate things like rehab, not only for the purpose of actually treating our patients and creating that safer pain relief environment, but also using it for diagnostic purposes to see that the patient's actually capable of getting back into their sport-specific activities. So once again, I'm Dr. Doerr and Dr. Jake Lavere, speaking for a safer pain relief environment.